Hey y'all, this is T.Feret, student physical therapist assistant. My journal article was titled "Do Chest Expansion Exercises Aid Reshaping the Diaphragm Within the First 72 Hours Following Lung Transplantation in a Usual Interstitial Pneumonia Patient?" This article was taken from Physiotherapy Research International, and its main purpose was to discuss chest expansion exercises during immediate post-op phase of a lung transplant recipient. Usual interstitial pneumonia is also called idiopathic pulmonary fibrosis. This does not have a true diagnosis, but it is commonly associated with males over the age of 50 with prolonged smoking. It is a chronic onset, usually takes a couple years to develop. And what's going on is that there's a hardening of the connective tissue surrounding the alveoli, which is the smallest component of the lung. What happens is the fibrinogen builds up within those tissues to where it potentially and severely blocks the CO2 and O2 transport that occurs at that barrier. Some interventions include O2 via the nasal cavity, usually seen as the patient walking around with the bag or the satchel with them. Medication, which usually prolongs the effects but doesn't necessarily cure them, and in severe cases, a lung transplant. Symptoms of the disease include shortness of breath, chronic dry cough, and respiratory crackles with inhalation and exhalation. As for the lung transplant surgeries, you can either have a double, where they'll take out both lungs, or a single replacement, where they'll just take out the one. There are also lobectomies, where they'll just go in and just take out the lobe that's affected, rather than taking out the whole lung. And these surgeries are very intensive. The incisions themselves are very, very extreme. So patients are usually in a lot of pain with these. The study was a case study of a 58-year-old male who utilized oxygen daily leading up to his lung transplant. He had a double lung transplant due to usual interstitial pneumonia, so he had all that plaque buildup and wasn't able to exchange gases accordingly. Informed consent was acquired for the study, and his treatment began 24 hours post surgery. The study lasted only 72 hours post lung transplant, and x rays showed elevated diaphragm post surgery, so his lung capacity was diminished due to the fact that his diaphragm was not working properly. The patient's forced expiratory volume of 1 second, which is how much air the patient can expel within a 1 second time period, was 61% of what it should be. His carbon monoxide diffusing lung capacity, which was his ability to diffuse CO2 and O2, was about 17% of what it should be. His treatments for therapy lasted 1 hour, twice daily, increasing to 3 to 4 times a day, while admitted in the intensive care unit as he progressed throughout the days, and the same therapist was with him every single treatment period. Some chest expansion exercises that may have been used during the study would be diaphragmatic breathing, which is inhaling through your nose and allowing your abdominal cavity to kind of go outwards to assist with opening up your thoracic cavity. And then as you would exhale, your abdominal cavity would go back in. Pursed lips breathing, that's inhaling through your nasal cavity and then making a puckered lip face and exhaling nice and slow. A rib stretch would be arching your thoracic cavity to open that up just a bit more, inhaling and holding that breath for about 10 seconds, and then exhaling nice and slow. And then numbered breathing would be inhaling for about 1 second, exhaling for 1 second, inhaling for 2 seconds, exhaling for 2 seconds, and so on all the way up until the patient reaches about 8 seconds. So exercises used by the therapist were primarily in supine, given the fact that the patient was only a few days out from surgery. The patient was still intubated, but was still breathing on his own, just with the support of extra O2 to help facilitate good oxygen diffusion. The therapist also used kind of tactile cues to help stimulate the inspiratory and expiratory responses, as well as utilizing accessory muscles to help facilitate those movements. And the therapist also encouraged prolonged expiratory phases, which is the exhalation. So he would have them breathe in and then exhale for a prolonged period of time. Some results from the study were from the numeric pain scale. The patient reported a 3 out of 10 pain throughout the 3-day study. He was also utilizing pain medication to decrease his pain symptoms from the surgery. His tidal volume started at about a 300 to 400 milliliters during the first 2 days of post-op and increased to about 850 to 900 milliliters third day post-op, which is a nice increase. His carbon dioxide diffusion went from a 60 millimeters of mercury down to a 45 millimeters of mercury, which is basically stating that he is transferring CO2 and O2 a lot more efficiently. His vital signs were also good. He was in the 95 percentile, so his blood pressure was good, his respiratory rate was good, his heart rate was good. And then also the imaging. So picture A is pre-op day. You can see kind of cloudy lungs, elevated diaphragm, and then picture D, bottom right, is about a month out. Nice dark lungs, nice and healthy, and the diaphragm is seated a little lower in that thoracic cavity. So, a summary of the findings from the study was that the chest expansion exercises were a very effective treatment in terms of regaining that lung function and the diaphragm mobility needed to get good inspiratory volumes who within patients with that lung transplant. Early intervention for patients with lung transplant is also going to be very beneficial, just getting them moving and getting their lungs functioning properly, just like any other muscle. And safety for the patient is also going to be beneficial to recovery. The patient was monitored regularly all day in the hospital in the intensive care unit and was given breaks between the exercises and the treatment sessions. Also, lung transplants are just a very complex organ transplant procedure. Some strengths for the study was that the same therapist was used for every single treatment. There was continuous intervention for the patient during the length of the study. He was always monitored in the intensive care unit. There was extremely quick results given this was a 3-day case study, and that they also did imaging on the thoracic cavity to visually see the improvements that were going on within the patient. Some weaknesses was that this was a short study, 72 hours, it's 3 days. There was no long-term follow-up after that month-long x-ray, that last x-ray I showed you. There was limited outcome measures to see how the patient was feeling and really get to see the data visually with numbers. There was no specific exercises stated, so the ones I showed you previous were just ones that may have been used, and that this was a case study, so there was only one participant, and we don't know if this can be replicated. So relating this to physical therapy, I've worked in an outpatient clinic for over 2 years now, and this is not something that I've seen commonly in the clinic. I've maybe seen chest exercises used once in the past 2 years, but given the baby boomers, I think this may be something that we'll be seeing a lot more frequently in the clinic, and it's something that we should be mindful of. Usually, manual therapies and therapeutic exercises won't be able to treat symptoms like these. So we have to think outside of the box and say, hey, take a step back and take a look at the big picture. And this also may need to be something that a specialist needs to look into, or other forms of intervention. We may not know all the answers, so we need to broaden our horizons to respiratory therapists and occupational therapists because they are the ones that are going to help us.